So, ladies and gentlemen who don't want to eat, there is a poster session which is starting now with an online presentation, a registered online presentation. This will be the PP1 presentation in the final program book. Thank you.
The effect of shifting to heated tobacco products on metabolic syndrome in long-term cigarette smokers. Preliminary results on a 4-year follow-up. Almas Sharman, Vladimir Arnautov, Academy of Preventive Medicine, Almaty, Republic of Kazakhstan. Metabolic syndrome is a prevalent condition in developed nations. It encompasses central obesity, high blood pressure, and irregularities in blood biochemistry. It stands as a firmly established risk factor for a range of chronic diseases, including cardiovascular disease, diabetes, and cancer. This condition affects up to a quarter of the population in Kazakhstan. Lifestyle choices, notably sedentary lifestyle and an unhealthy diet, play a pivotal role in the development of metabolic syndrome. Additionally, cigarette smoking has been identified as a contributing risk factor. While complete smoking cessation is strongly advised, some long-term smokers find it challenging. As an alternative, some may transition to heated tobacco products, which certain studies suggest may have a lesser impact on health. The objective of this study was to scrutinize the enduring effect of transitioning to heated tobacco products on the prevalence of metabolic syndrome in comparison to persisting with traditional combustible cigarettes among long-term smokers. For this investigation, a cohort of 1,200 participants was assembled, comprising 800 individuals classified as conventional cigarette users, CC, and 400 participants who had recently transitioned to heated tobacco products, HTP use. These participants, aged between 40 and 55 years, possess a minimum smoking history of 10 pack years. They were enrolled and subsequently monitored over a period of 48 months. At the onset, a comprehensive set of data encompassing demographic, medical history, smoking behaviors, blood biochemistry, and related variables was gathered. Subsequent follow-up sessions involved the collection of additional data, including blood biochemistry, lung functions, and other pertinent clinical characteristics. The frequency of metabolic syndrome occurrences was compared across visit at baseline, 12 months, 24 months, 36 months, and 48 months using the chi-squared test. Now, let's turn our attention to the findings. Among heated tobacco product users, there was a noteworthy reduction in the prevalence of metabolic syndrome, decreasing from 35% to 28%. This is in contrast to conventional cigarette users, where the decrease was from 35 to 30%, showing a less significant change. Both heated tobacco products and conventional cigarette users experienced significant reduction in the prevalence of lowered HDL-C levels. The prevalence of elevated blood pressure exhibited a notable decrease among heated tobacco product users, dropping from 17 to 11%. In comparison, among conventional cigarette users, the decrease was from 17 to 13%, showing a less substantial change. This study represents one of the largest cohort investigations examining the extended use of both conventional cigarettes and heated tobacco products. We have illustrated that while both CC and HTP users witnessed a reduction in the prevalence of metabolic syndrome components, HTP users experienced a more substantial decrease in a greater number of metabolic syndrome components. The findings from the study suggest that for individuals with an extensive history of cigarette smoking use who struggle to quit, HTP may present a potentially less harmful alternative. However, it's important to note that these analyses are preliminary and further research is imperative to fully comprehend the effect of transitioning to HTP on metabolic syndrome. Therefore, prudence is advised when interpreting these results. Thank you.
Go to the next poster session, which is the integrated approach to the implementation of pulmonary rehabilitation in patients with COPD patients, from Tatiana Tagutina, if I'm spelling right. Thank you, sir.
Good afternoon, dear colleagues, my name is Tayutina Tatiana. COPD significantly affects the quality of life of patients, which makes it necessary to include in the algorithms of management not only drug correction of the disease, but also complex rehabilitation measures with mandatory lifestyle modification. The aim of study was to evaluate the effectiveness of an integrated approach to the implementation of the outpatient stage of rehabilitation with mandatory lifestyle modification in patients with chronic obstructive pulmonary disease after an exacerbation of moderate severity. The analysis of the effectiveness of outpatient rehabilitation programs in traditional cigarette smokers with chronic obstructive pulmonary disease who suffered an exacerbation of moderate severity with the inclusion of a stage of correction of risk factors. Two groups of clinical observation were identified using an integrated approach with mandatory lifestyle modification, including complete cessation of smoking traditional cigarettes and the use of alternative methods, and a control group without mandatory lifestyle modification. The effectiveness was evaluated by determining the functional parameters of the lungs, the severity of shortness of breath, the level of oxygen saturation of the blood, the 6-minute walk test, and the body index. The quality of life was determined according to the MOS SF36 scale. In the course of the study, it was revealed that most of the patients in the control and experimental groups had an high and very high degree tobacco dependence. The motivation to quit smoking was either absent or weak. In both experimental groups, after 4 weeks from the beginning of the outpatient stage of pulmonary rehabilitation, there was a tendency for an increase in MEF at the level of small and medium-sized bronchi in the first and second subgroups. Statistically significant positive dynamics of blood oxygen saturation level was revealed in the group of clinical observation with mandatory lifestyle modification with complete cessation of smoking traditional cigarettes and using alternative methods in the implementation of the concept of harm reduction from tobacco smoking. There was a significant decrease in the severity of shortness of breath in the subjects of this group, a statistically significant increase in exercise tolerance, 6-minute walking test scores, and the body index. At the same time, no statistically significant changes were detected in the control group. In the clinical observation group, there was a statistically significant improvement in the quality of life indicators characterizing the state of physical health. An integrated approach to pulmonary rehabilitation with mandatory lifestyle modification is in the form of complete cessation of smoking traditional cigarettes and the use of alternative methods of nicotine delivery contributes to efficiency, reduces the severity of symptoms, reduces the rate of disease progression, improves quality of life, increases exercise tolerance, and improves prognosis. Thank you very much.
Much for your presentation. What is the number of the COPD patients who can go to the pulmonary rehabilitations in total? So how many % of the diagnosed COPD patient can go to any kind of rehabilitation program? Have you got any idea about it?
Good afternoon, dear colleague. It is necessary that the possibility of lifestyle modification be prescribed in the clinical recommendation that guide doctors to choose treatment. After that, doctors will be able to use scientific achievements in this field in their clinical activities.
Yeah.
Thank you very much.
Thank you. So thank you very much. And maybe we can go to the next session about the changes in hemostasis parameters in smoking patients from the Ural State Medical University.
Dear colleagues, my name is Svetlana Vedenskaya. I want to share with you the results of my own research. Changes in hemostasis parameters in smoking patients with arterial hypertension and multifocal atherosclerosis. Smoking is one of the main risk factors for the vascular complications. One of the reasons for the stroke development in smoking patients with arterial hypertension and multifocal atherosclerosis is the hemostatic disorders leading to the formation of hypercoagulability. The purpose of the study was to establish the characteristics of hemostatic disorders and the possibility of their correction in smoking patients with MFA and arterial hypertension. Materials and methods. The study included 134 patients with AH and MFA from 40 to 70 years, of whom 32 were smokers group 1 and 102 patients were non-smokers group 2. The average smoking experience for the first group was 24 years. The groups were comparable in terms of clinical parameters and concomitant therapy. Hemostasis parameters were evaluated using the thrombodynaamics test of the diagnostic laboratory system Thrombodynaamics Registrator Hemocore Russia. Results. When analyzing the parameters of coagulation hemostasis, such as initial clot growth rate and stationary clot growth rate, were higher than reference values in the first group patients. Analysis of smoking effect of hemostasis parameters revealed a statistical difference in smoking patients for clot growth rate and clot size. Spontaneous clot growth was noted in both groups, but significant difference were not found. Conclusions. Smoking patients with AH and MFA have changes in the coagulation link of hemostasis indication and increased risk of thrombosis compared to non-smokers. The main harm for smoking is caused by combustion products, which disrupt the balance of hemostasis factors and contribute the occurrence and spread of thrombosis. Smoking cessation should be a component of treatment. In a clinical trial published in 2019, it has been shown that switching to smokeless products decrease biomarkers of clinical risk of thrombosis. Thromboxane by an average of 7.2%, a reduction in oxidative stress levels by an average of 12.9% compared to those who continued smoking. For patients who are not motivated, don't want to quit smoking completely, the concept of harm reduction can be recommended. Thank you for attention. You can find my contact information here, and I am ready to answer your question.
Thank you. Thank you for the presentation, which was really nice in this field. Actually, I think we can move on the next step because we are ready. So if there is no question, it means that thank you. Yeah, you have a question. That's wonderful. Maybe it's you have to find a microphone. That's basic. Yeah.
How does it work? Hello, I have a question. What is the treatment tactics of smoking and no smoking patients, and if there any difference? Thank you.
Thank you for your question. In the treatment of such patients, we use clinical. Unfortunately, they don't contain chapters of management of smoking or non-smoking. Often we recommend smoking and that's it. Okay,
And I guess just also continue this question, yes, but this measure turns out to be insufficient. According to our research, 58% of our patients after ischemic stroke. So it's very important to have a patient-oriented approach, yes, for those patients who is ready to get smoking and for those who are not ready to do this. So thank you.
Thank you. That was an answer. So maybe if there is any more question, there is the internet address, so we can address it directly because it's. So thank you very much for the presentations, and thank you very much for the presenters. I think we have to move for the next session. Thank you.